Oh, sure. Migration goes both ways.
On that subject, and it's a good one, Jane in particular had real experience on this when we undertook the Vermont's welfare reform in 1994, where we did an analysis of mobility in and out of the state. Forgetting the results of it, but that work is really important and can be done, so looking forward to it.
We actually found that report,
Okay.
factored into our discussions.
Other comments or Dr. Hsiao?
If you wonder why we look so sleepy, I hope we gave you some explanation. And like Jim, I'm technology challenged. I'm still working with this rather than computer. And so I'm going to just talk from my notes. What I would like to do is to tell you, share with you what we have done and what some of our preliminary findings, not our proposal, we're still working on that, but what actually will guide our designs. First of all is we completed quite a very detailed analysis of the Vermont's current situation. We concluded your current situation, you really have I call it a broken system. And you cannot be, actually just will continue to erode unless you take some major steps. What's the indication of that? Well, one is the healthcare cost is rising very rapidly in Vermont. And this, from the financial analysis we have done as well as the interviews, the employers are complaining a great deal about the rising cost in health insurance. And so consequently, that has become a major point of negotiation between workers and the management. And the management often have to try to reduce the benefit package or ask the workers to contribute more to pay for the premium. And that's because the cost is rising very fast in Vermont, which you know. And also the number of uninsured in Vermont, in spite of the catamount and other efforts you made, remain to be at about 7.5% level. And so there's calling about the equity of the current system. Then there are other things going on. That is, your rural health care, in spite of a great deal of effort, it seems to be weakening. And your medical care system is shifting more and more to be a specialist-focused healthcare system, rather than you seek to be a more primary care focused system. So the current system is not doing what you wanted it to. It does, and also some of your community hospitals are weakening. So one of our findings is Vermont has to do something. And the status quo is not sustainable, and it's not in the best interest of the Vermonters. So we're giving the charge of developing 3 options. The first one is very clear. It's what we call a pure single-payer system, and that will have universal coverage, and it will be government-run, and you will have as a comprehensive benefit package for every Vermonter. Then the question is that affordable? How much does it cost? So we have to estimate the cost and also see who can bear that cost. And the second option, which is a public choice option, that will not achieve universal coverage. And you just add another option on the insurance exchange, which will be offered by the government. And hopefully the government can bargain harder with the physicians, doctors, and nurses, and medical homes, then you can offer a lower premium. So the public option is introduced, alternative, hopefully is at a lower cost, but it will still not achieve universal coverage. Then the third option is what you left for the consultants to do, and we, in the law, it says what we think is viable and practical. So to look at how viable that is, then we conducted first the stakeholder analysis by reading your history, your legislative history, as well as the other efforts you have made over the past 20 years, and ask why didn't those reform efforts move forward? What led to its failure? So is there some way we can do a better job on this go-around? And the other part is to look at, to interview the major stakeholders in the state to see.
Could we just wait until Lauren can change the CD to record your testimony? I'm sorry to stop you
Sure.
in mid-sentence.
More technology.